Why is it necessary for nursing documentation to contain comparable data?
Well, it's important for documentation to have comparable data because you want to keep track of whether the patient is progressing or getting worse. And if they don't have comparable data, then, like, if you don't have it tracked, then you don't know what is accurate for them, like what is their normal, what is their not normal. And you just can't go in and say that they have that illness or condition without having facts and things to base that on. This can cause a lot of confusion with your healthcare team, and according to one of the articles I read, mistakes in documentation can occur without comparable data as well, which leads to miscommunication and other legal issues. Okay.
What do you think is an agreeable compromise between free text documentation and the need for a more structured documentation?
Well, using the EMR to translate the free text into structured documentation would be the best way to go about it, because there could be a set word for letters that nurses use to document certain things or conditions or medications that the EMR could translate into a full word. And this documentation would be quick and easy and be structured at the same time. And this could be like personalized for each floor, like one for cardiac, one for ortho, and they could do their abbreviations and their meetings for certain things, and it would be a good compromise for the nurses when they are who prefer documenting free text compared to structured text. And the ones who do prefer structured documentation, they could still type out whatever they want.
How do the terms meaningful use and best practice impact the future nurse of EMR, EHR use in the healthcare system?
The term meaningful use means that the patient will receive the quality care needed or that they deserve by keeping the documentation process quick and getting all the necessary information needed to predict the best diagnosis and to provide the best care for the patients. It helps to convey that the EMR will continue to grow and become an even more efficient tool for nurses in the healthcare setting or providers for them. And since it'll help like conserve time, then it'll allow for nurses to answer call-outs quicker and the documentation is also more accurate and easier to understand for the other nurses whenever the shift changes. And the term best practice also makes the EMR look good. The EMR is proven to be the best method for documentation to date, and it'll likely be used to improve and improved better in the future of healthcare. Both terms have a good impact on the future of EMR, so yeah, we'll probably still use it or some form of it, because we're always evolving in healthcare. Nurses are all about adapting.
There are some interventions of patients' care that are not documented, yet has an impact on patient outcomes. What solution would you recommend as healthcare moves into the future?
Well, whenever the EMR was first implemented, since it's been there's been less mistakes in documentation, and there may be some things not documented just because, like, for certain things are structured, people are not looking at those. So I think that if we were to like look at the things that is not necessarily deemed important, but it could be important, and put that into the documentation, because it could affect the patient's outcome or their diagnosis or whatever. And the EMR makes it easier to input things, a lot of information in a short period of time. And I believe probably a comprehensive assessment or something more focused for that area, for the information that is not there, should be added so that we could assess their overall health and their mindset and whatever, how they are going through their time. Because when they come to us, we are seeing them in their darkest hour. We are there for them, even though they feel like they're alone. So any pain or abnormalities or anything out of the normal, that should be documented too, so nothing can be overlooked. So there's a bunch of positive things about the EMR, and it also makes it super easy for vitals to be recorded. The documentation has really made it better. And one of the articles I read, in the articles Factors Influencing Healthcare Professionals, they talk about, they did a survey sort of where they saw what nurses and other nurses thought about it, and a lot of them thought that the EMR brings benefits to the health organization by minimizing medical errors, and helps to improve the quality of patient care and offers more organized notes on patient information. And a lot of people like how it's easy to use and it helps to improve the functioning of the healthcare facility.